Welcome. My name is Julie Babbage, and I'm the Executive Director of the Diabetes Patient Advocacy Coalition. Welcome to the Florida Diabetes Advocacy Forum. We are so excited to be with you virtually in the Sunshine State to talk about diabetes and specifically what the key issues are in diabetes advocacy and how you can advocate for change in your state capital, as well as Congress with Deepak. Deepak advocates on behalf of all people with diabetes, type 1, type 2, parents of children, caregivers, and others. And looking at today's registration, we actually have folks from all across the spectrum, all those groups represented here today, which is great. I'll begin with an introduction of Deepak, and then we'll look at what Florida specifically has done so far on diabetes legislation and opportunities, which would then take us to the issues themselves. And we'll give an overview of our top priorities as an organization, which centers on affordability and access for people with diabetes. And then we'll transition to the state and federal dynamics in Florida politics, and specifically how to be a diabetes advocate and a Deepak champion. And looking at just a couple housekeeping notes, if you have any questions for us or the panelists, please submit them at any time. Today's meeting is being recorded here and on Facebook Live, and we'll send out a link after. And we appreciate all of you joining us. So as I mentioned, we are working on behalf of all people with diabetes, and Deepak's mission is solely advocacy. That includes state work and federal work, making meaningful changes in law and regulation so that people with diabetes can live long, healthy, and productive lives. And Deepak formed because it was abundantly clear that lawmakers were not hearing from the patient community when making decisions that impact people with diabetes. And we know how passionate the diabetes community is when it comes to advocacy. So we understood that it came down to knowing which issues mattered and then mobilizing to weigh in on those issues. And so that's what our work is focused on, making it easy to advocate for yourself and your family on these specific topics. And we have events like today and resources to educate and empower people with diabetes. And we also have what we call Click Advocacy platform, which empowers patients to send letters with just the click of a button. And that those go to lawmakers and health leaders on key issues when it counts. And this makes it possible to share your story with government leaders who really need to hear from you, the constituents, when making decisions. And in registration, 80% of you indicated that you have not met with an elected official to date. And I want to be sure we mention right here up front an exciting opportunity for advocates nationwide, and that is our annual Hill Day coming up at the end of the month. And I'm going to touch on it more at the end, but please go ahead and mark your calendars for October 18th, and we'll tell you a little bit more about what that opportunity looks like and how those of you who haven't had a chance yet to meet with a lawmaker will get a chance to do so. A little bit more on Deepak. We are proudly affiliated with the Diabetes Leadership Council, which is the policy side of things to our advocacy-oriented organization. And DLC works on how bills are written, the impact of those bills. They help to educate lawmakers. And then Deepak brings together the patient community to speak up and speak out on those issues. And both of us partner with diabetes organizations across the spectrum to build consensus on action that needs to be taken for diabetes. What is a Deepak champion? So you're going to hear us talk about the advocacy community, our subscribers, and what we call our champions or advocates. We have thousands of subscribers, but a champion is someone who is beyond that, someone who is taking action and gets involved in a deeper way. And so just by expressing interest today and joining us for this forum focused on state advocacy, you are already in this champions network. And we rely on our champions to be involved and also to help those in their friends and families and communities and networks also be involved and sign up to advocate. And so we ask our champions to recruit 5 or 10 people who also care deeply about diabetes to join us as well. The stronger our numbers, the more that we can accomplish. And speaking of those numbers, actually on the next slide, you'll see more about this community. We are proud to have champions in all 50 states who are part of our advocacy army. And you can see some of their profiles here. And a special shout out there to Mike, who's joining us from Florida, and really thank him for his years and years of diabetes advocacy. So transitioning now into our policy discussion. Today is focused on state politics and state legislatures and bills that we're active in and talking through these issues. And we want to show you where Florida specifically stands on the bills that many states are filing and passing. And so you can see that there are some boxes on here that are checked. There are some boxes on here that are not checked. Florida has a lot of opportunity to make some significant strides. You also see some of those briefcase icons, which means the state has introduced those topics and had bills active last session to address those topics. But those bills did not pass or become law. And so there are opportunities for us to get to work on this coming session. And our panel is actually going to touch on these issues, starting really with these boxes that are checked. I'd like them to go ahead and join us as I introduce them. This is a chance to really deep dive into the issues that everyone in diabetes policy and advocacy is talking about, and the ones that we really care about as an organization. So first, Stuart Perry is the vice chair of the Deepak Board of Directors and the chair of DLC. And he was also past chair of the American Diabetes Association. And joining him, we have Erica Emerson, the chief policy officer for DLC, who has decades of experience in health policy and is going to break down some of these issues for us today as we think about how to advocate specifically in the state of Florida and what the hot topics are.
So in late 2020, Diabetes Leadership Council, DPAC, and actually a total of 12 national diabetes organizations. This was a first ever collaboration across all these different organizations, came together to develop a consensus statement. We were looking at the changes that need to happen at a federal level to help people with diabetes improve their health and frankly make it more affordable. So this is our legislative roadmap. A lot of these ideas are applicable at the state level as well, but this is a roadmap for federal lawmakers who want to help people with diabetes to actually do it in a meaningful way.
So what we're recommending to people on this call is to go to the diabetesleadership.org, download this, and then either email it or print it and take it to their member of Congress, their state senator, their state legislator, because this gives real-time necessary answers for people with diabetes and their health coverage. Is that correct?
Correct. And legislators love facts and figures. So you'll find lots of facts and figures in there to back up the arguments. Again, for advocating for preventive coverage for insulin and other diabetes necessities, low predictable cost sharing, again, making it easier for people to afford their diabetes management instead of the government or an insurance company paying for costly complications.
Okay, so let me address a couple questions that have come up before we close out real quick, Erica. I think that the resources that I mentioned when we talked about affordable insulin are available on a number of different websites, correct? The websites that you go, because patient assistance programs from drug companies are sometimes difficult to navigate, difficult to get to and to find. So is there a one-stop shop in a couple different places that people can go to find those resources?
So the best option we found for a one-stop shop is called getinsulin.org. That is a collaboration of a lot of different manufacturers, some other patient advocacy organizations to be a single point of contact for a number of these assistance programs. Again, we wish they were not necessary. We wish they were obsolete. We wish every person with diabetes paid $0 for their insulin as they should. But until that day comes, there are assistance programs available. There are now lower cost biosimilars and authorized generic products that are available at retail for a much lower cost than people are sharing or paying as list price. So it takes a bit of legwork to find the best option, but there is help available.
Including going to Costco and Sam's Club and Walmart and the other things we mentioned. You know,
Exactly.
one of the things that both DPAC and DLC advocate on is making insulin and all diabetes supplies, education, and medications first dollar coverage, which means if you have insurance, it should be just like a flu shot, a COVID shot, a mammogram, that they're preventative. And we're advocating every single day for that exact thing. So there's a question that someone has asked a couple times, Julie, on managing your diabetes and who's in charge and what do you do. Let me say, I've had type 2 diabetes for 35 years. When I was first diagnosed, I managed it 100% with diet and exercise. Probably not enough of either, but diet and exercise. And sometimes you can do that. Diabetes is a disease that treats everybody differently. So you've got to meet with your medical team and you've got to decide and advocate for yourself in what your therapy, what your treatment should be. I am almost 65 years old and I've had a heart attack. So I look like a Walgreens or a CVS drugstore twice a day when I take medications. Not everybody has to do what I do, but that's what it does for me. And that's why diabetes is so individualized and why diabetes has to be treated differently for everybody. So the other question that came up real quick, Julie, I know I'm getting hooked, is about CGMs. And CGMs and devices and blood sugar testers, they all fall into this rebate scenario. They fall into this deal where they have to pay a rebate to get on the formularies. Correct, Erica? Which drives up the price. The rebates drive up the price for all of us, not just the rebates on Blue Cross health plans or Humana health plans. This rebate scheme that we're under in the United States of America has to end. Julie, I know we've got to close up because we've got to go on to another part of the program. Erica, any final thoughts you want to give?
I would say there are lots of reasons to get mad, lots of reasons to get angry. Best thing you can do is get active, get involved, help us tackle these problems. Right, Stuart?
And that's correct. And Julie's going to talk about that. And let me just leave this part of the program this way. You can't sit and wait for somebody else to do something. You have to get involved, whether that's just sending an email and signing up for the program that Julie's going to talk about, or whether that's going and visiting with your member of Congress or your state legislator, or whether that's advocating with your insurance company or your doctor for the kind of care that you want for yourself or your family member. You can't sit on your hands and wait for somebody else to do it. As long as there is breath in my body, I will be advocating for all people with diabetes who either can't or won't stand up for themselves. But I'm just one person. I know Julie and Erica think I can do a whole lot, but I'm just one person. And we need hundreds and thousands of one people out there in this fight each and every day. Remember when COVID shots first came out? People with diabetes weren't prioritized. We fought on that issue, and we're going to continue to fight each and every day for all of you all out there and everybody that's affected by diabetes. Julie, thank you for the opportunity to stand on my soapbox and preach. And if I can get an amen, I'll shut up.
Amen. Amen. No, you've got lots of amens for sure. You got some amens coming from our audience as well. No, I was actually coming on to ask you some of the questions from the audience. So I appreciate you, taking those as you could see them as well. And also want to bring you back on to talk about some of the things you discussed just now to later on at the end of this presentation. But Erica, we passed over the slide on preventive coverage, and I was just going to have you just briefly explain what that means and how that impacts affordability and access to the whole suite of diabetes care and coverage.
I was trying to cut time, Julie.
I'm messing with your plan.
We did breeze through it. Again, if people want a deep dive, we do tackle that in the consensus statement. But basically, preventive coverage is, frankly, our understanding of it and insurers' understanding of it, it has expanded. When the Affordable Care Act first came out, preventative coverage was strictly interpreted as the prevention of disease. So it would include things like immunizations would be covered at zero cost, or at least pre-deductible. So you wouldn't have to pay hundreds or thousands of dollars before your insurance kicked in. Now the IRS came out with guidance, I believe 2 years ago, and more plans are starting to realize that diabetes management is in of itself preventive care. So they're starting, more and more are starting to cover it pre-deductible. So starting on day one of your health plan, instead of making you hit that high cost hurdle just to get your insurance coverage to kick in.
Awesome. Thank you for that. And one other thing, I wanted you to plug maybe the employer initiative and just talk about it briefly. We had a question on employers, I think somewhere. Yeah. Are there any options to buy private insurance through employer and have to meet a deductible and pay for diabetes supplies at very expensive prices before and after meeting the deductible, and that choosing the better plan, that is choosing the better plan with the lowest deductible. So some questions on private. Go ahead, Stuart.
Well, before Erica talks about the employers initiative, let's talk about the Affordable Insulin Project, which is part of Deepak. On that website, there is worksheets that you can do and you can do with your employer to talk about what you need with diabetes coverage. It's a little old, but it still works. It still does what it needs to do. And so while Erica's going to talk about the education part of this, an individual part of it is to go to the Affordable Insulin Project, download those worksheets, and then go through them. Because if you're going to talk about deductibles and what you pay for medications, you've got to do the math. You've got to know what you spend and on what before you pick the plan that most companies give you a cafeteria option to do. And they need to understand why it's important to you and what your costs are. I'll shut up, Eric, and let you talk about it.
And I know we're going to get questions about the website. So that's affordableinsulinproject.org for everybody who has a question about that.
The nice thing is this, this is a topic where not just DLC and Deepak, but a lot of our advocacy partners are getting more involved as well, helping people with diabetes choose and use the right health plan. So for example, if you've got a young person in your life, College Diabetes Network and the Diabetes Leadership Council collaborate on what we call Insurance 101. It's helping young people understand insurance and to use it, maximize the heck out of it so they can afford not just their coverage, but afford their diabetes essentials as well. So that's important one for advocates to kind of stand up for themselves and get themselves in the best health insurance plan they can. But for folks who get their insurance from an employer, there's a big learning curve on employers' side as well. So Diabetes Leadership Council works with a number of employers in collaboration with JDRF, helping to educate employee benefits and HR professionals on how to structure health benefits, health plans to make diabetes more affordable. And again, make it affordable for people so they have better health, better quality of life, and they're more productive employees. We found very few employers who aren't receptive to the idea. They just maybe aren't familiar with diabetes or CGM or how complex diabetes management can be. So when they know better, we hope they do better.
And Julie, very, very honestly, one of the reasons that we started that program is because when you talk to a kid that's 27 years old, just come off their parents' plan at 26, or a college student just graduating from college, as Hunter Limbaugh is so, one of our board members is so apt to say, those kids should not have to decide on a job purely by benefits. They shouldn't take a job they didn't really want just because it gave them the benefits because of their diabetes. They need to be able to do what Julie Babbage did, which is go to 2 or 3 different jobs until she found her calling and now is doing what she loves. Though sometimes that doesn't happen when you have type 1 diabetes or even type 2 diabetes. Benefits should not control your life. And that's what we're talking about.
Absolutely. No, I think those are excellent points. The last question that I wanted to address, then we'll answer some of these as well through typing, is just the donut hole. Erica, if you could speak briefly to that and, Medicare and some of the challenges there that patients face.
So technically the donut hole has been closed, but that doesn't mean necessarily that patients are having an easy time affording their medication and insulin specifically. If you're in Medicare, it becomes a little bit trickier to get help with your prescription costs, but there are options available. There are low income subsidies and assistance. But one of the most important changes in the past couple of years is the Medicare senior savings model. Now, when you go to choose your plan for the next year, if you put in your insulins, there are thousands of health plans that are now participating in the senior savings model plans that cap insulin cost sharing at $35. So as you're going through and choosing your plans, there isn't an option this year to check insulin savings. So you actually need to enter the drugs you take, and it will help you understand which plans are participating so you can make the right decision for your diabetes and your situation.
That's perfect. Thank you so much for those explanations, and thanks guys for joining us on the panel today to go through the issues. And for those who still haven't had their questions answered, we'll type some answers to you so that we're sure to address those. Thank you.
All right.
And that thanks. We'll jump now back into our presentation here, and specifically an overview of Florida and the political situation there, from the congressional delegation to the state process as well. So let's start with Congress. Like every state, Florida has 2 senators, and they are elected every 6 years. On the House side, Florida has a major advantage compared to other states, just given the sheer volume, the population. And so the numbers you see there are bigger compared to most other states in terms of number of representatives. And Florida actually gained a seat due to the 2020 census as well. So if you're not sure who your representative is, you see that link at the bottom of the slide there, and you could check there by typing in your address. While we're on the topic of Congress, one group that's really important for us to mention from the patient community aspect is the Congressional Diabetes Caucus. A caucus is an informal group of lawmakers who have shared concerns and shared interests. They're often very bipartisan, which is a good indication that issues like diabetes should not be Democrat or Republican. And the caucus exists at the state level too. You saw on the scorecard that box is actually checked for Florida. The notable thing about the Congressional Caucus is that it is the largest health caucus active in Congress. There are actually more members that are in the caucus than are not in it. So that's also just a good indication of how strong our voices can be on this issue, because diabetes is so impactful across the nation. It is bipartisan, it's chaired by a Democrat and a Republican. And one of the asks that you can make on our website at any time is to the newly elected representatives as of 2020. So those are what we call freshman representatives. You see here 4 of them. If you're in one of these districts, the ask is open to you to send a letter encouraging them to join the Diabetes Caucus. It's not a confirmation that they'll stand, in exact alignment with the things that Deepak wants or works for, but it is an indication that they care about diabetes, and a lot of the legislation aimed at working on the issue more broadly comes out of the caucus. And so it means that they're plugged in, it means that they're interested, that they're talking about it. And so you can make the ask on our website if one of these 4 is from your district to ask them to join the caucus. And it means the most, of course, coming from a constituent. So we encourage you to do that. Moving to Florida now, the state, after having done the federal, Florida is one of 38 states where there is a trifecta, which means that the House, the Senate, and the governor's office are all held by members of the same party. And in this case, of course, it is Republican. The Republican majority has been the case in the legislature for a while now, the past 15 to 20 years in either chamber. It's helpful to understand these dynamics because it means for a bill to pass the legislature, it needs to have Republican support, it needs to have majority support, not solely Democrats. And it means that bills with no Democrat support can also pass. Republicans can advance their own agenda with a simple majority. It's also worth noting, though, that if Governor DeSantis vetoes anything, Republicans do not have what's called a supermajority. So they don't have a 2/3 majority, meaning that they would need some help from the Democrats to override a veto from the governor. Florida also does have term limits. It's one of the few states that does. And so that means representatives and senators in this case are capped at 8 years. For the House, that means that they can serve 4 2-year terms. And for the Senate, that means they can serve 2 4-year terms. And currently, Florida is out of session. They will not resume until the new year begins. And this means that While there are some meetings, in particular committee meetings are ramping up in Florida in what's called the interim session, sort of the off season, while the legislature isn't technically active, but they're still meeting. That's a lot of times this is where we start to ramp up our state advocacy efforts. We talked about the insulin copay cap that was filed by Senator Janet Cruz. She actually left a video message for you all joining us today that we'll share after in a follow-up email, where she describes the bill and encourages everyone to be supportive of it. And we're thankful for her efforts and for opportunities to help Florida check more of those boxes on the scorecard. Legislators come to the state capitol with all kinds of ideas and issues and things that are local and things that are statewide. And many of them, are looking to hear from you, from their constituents, the folks who elect them, that diabetes matters to you. It really motivates them to pass bills. So a lot of times the ask for us is reach out to your legislator and ask them to sign on to XYZ bill. That means that they're then co-sponsoring the bill. They're joining in officially to say that the bill is important to them. Sometimes it's that they vote yes when the bill comes up, either in committee or on the floor. And so you'll see those various asks delineated. And again, it means the most coming from you. In terms of how to pass legislation, this next slide, how a bill becomes a law, just briefly we'll go through that, because for those who are new to the process, it can be a little confusing. I've already used some of the nomenclature. So first, a sponsor, a member of the House or the Senate, any elected member files the bill, the legislation, and then the the committee will then vote on it. And the bill is assigned to any number of committees. Legislators serve on multiple committees. And so maybe it goes to the Health Committee or the Education Committee, whatever the subject of the bill is. And then it comes to a vote on the floor. So in that chamber, the House or the Senate, whichever it started in, and it goes through the whole process again. But the point here is there are a lot of times when the bill is up for consideration. Sometimes bills never even move. And so it really takes the community being plugged in, the broader public knowing what's going on to push these bills along in the process. And that's really what Deepak is all about, what we're helping you to do. And that moves us right into how to become a Deepak champion. A lot of you asked, okay, what are the next steps? What can we start doing? We're ready now, we're filed up. And that is just to start doing things like you're doing today, which is joining us for these types of events. We have many. We are really, our platform is so that anyone can participate. It means that if we have a letter or a bill to sign, a letter to sign onto a bill or to vote a certain way, that platform is really just one click. And you can even add your own story in that process. We'll show you an example of what that looks like on the next slide. But taking action is super important. And on that note is our big event that we're having that we're so excited about. So our Hill Day in the past has been in person, actually. We've had folks come to the Hill, to Congress, and go office to office and apply and explain to their members in person or to the staff in person in these offices why diabetes is important to them, and specifically what issues based on Deepak's priorities, what issues are we would like them to move on or vote on or sponsor even. And so our virtual Hill Day, this is a first for us this year, will take place in Florida at the start of our Hill Day week. So the whole week we have days split up among different states, and Florida's day is the 18th, is the very start. So if you're wondering about the time commitment, it's about 3 or so meetings that we'll have for you for a total commitment of less than 2 hours during that day. And we don't send you into these meetings with no prep. So also you would mark your calendars for the training on October 12th, which is where we'll run through it all with you. Do's and don'ts, what are our asks, why is this important, how to talk to a legislator, tips and tricks and all of that. So registration was actually set to close today, but we've extended it a day to allow all of you who were unaware of this opportunity to register. So again, those 2 dates for your calendar, October 12th and October 18th. You can see the link here at the bottom, which is where you register, but we'll also send this out in the email after. It's a really good chance to get your feet wet with advocacy and to, in a group setting, but also in an individual setting in some meetings, get the chance to have conversations and lead conversations on a diabetes advocacy trajectory. So we're really excited about that. We also have other events like brown bags, policy briefings. We have a newsletter that comes out monthly, and we'd love for you to go on our website and subscribe to that. Follow us on social media for all of these updates, and make sure that you're subscribed to Deepak to learn about these events as they are announced. This last piece right here, another bit of how we advocate, and really as we wrap up here, we want you to know that the most important part of this process in any meeting with a lawmaker, whether it's at the state or the federal level, is telling your story. And several of you have done so in writing into us today already, sharing pieces and parts of why this is so important to you, or the personal struggles that you've had as you're trying to access a certain device or a drug. And so that's why you joined us today. It's why you advocate, and it's key to your impact as an advocate. So legislators are going to respond to your personal experience. It's what they remember. It's what motivates them to emotionally and literally. It's what moves them to act. So on the screen here, you see an example of what would come up if you took an action on our website. And there's always a spot for you to input why you're writing it that day. You're a little bit more about your own story. So we wanted to show that for you for when we do have calls to action in Florida, or Congress, where Florida's representatives or senators are involved, what that's going to look like and how we go about that. We've got one last panel for you as we wrap up today to get to tell their personal stories and share just a little bit more context as we talk about advocacy and staying motivated. And I'd like to go ahead and introduce them as they turn on their cameras. So we have Ed Hawthorne, and we've got Stuart Perry coming back to join us. So Stuart, besides his professional roles, he's had type 2 diabetes and a long line of family connections to diabetes, including a son with type 1. Ed Hawthorne is the vice chair of Deepak's affiliate organization, DLC, and he is former chair of the board for the American Diabetes Association. So thank you both so much for being here today. And oftentimes we ask our panelists and our advocates, really, when they first go into a meeting, each of us has a why we advocate, why we do this, and we would love for you to share as an example what your why is for why you advocate. So Stuart, we'll start with you.
Let's go to Ed. They've already heard from me for a long time.
Okay.
Let's let Ed start, because I know time is going to be tough here. You're muted, Ed.
I think you're muted. Yep.
There we go. How's that? Is that better? Okay, I will start. Stuart's heard this story, but the main reason that I joined the fight and advocate for diabetes is to make a difference in the lives of others, and it always feels good to do good for someone else. But I originally got involved, and I'll make this story short. Our CEO of my employer was being honored as Man of the Year for the American Diabetes Association. The company tapped me on the shoulder and said, "You're the corporate sponsorship chairman." And I said, "What do you mean?" They said, "Just go out and raise money. Get our vendors to buy tables." Who is it for? The ADA. Who are they? They do stuff around diabetes. Never heard of the ADA before. Only thing about diabetes I heard was a little bit of sugar, but I didn't know anybody who had a little bit of sugar. So the more that I got involved in this role, the more I learned about diabetes. The more I learned that there were more people that surrounded me that had diabetes or were impacted by diabetes than I even realized or knew. I also found that diabetes didn't discriminate. It didn't care what color you were, how much money you had, what kind of job you had. It did not matter. And then I thought, well, boy, maybe this is an opportunity for me to participate, because I don't have to have diabetes to be impacted by diabetes. And I don't have to have diabetes to be able to join that fight to help something that impacted everyone. And so that's how I got involved, and that was some 30 years ago, and I'm still here.
Well, it's a great example too that anybody can join this fight. You don't have to have diabetes to be a diabetes advocate. And thank you for that reminder. Stuart, I know you've been doing this for a while. Can you just describe, either the progress that you've seen in your lifetime and also how you deal with the fact that this system can be slow and inflexible and really, I think, challenging as advocates sometimes write in or sometimes are really being active and they're not seeing the changes that they're pushing for?
Sure, Julie. And let me first of all say that when I first went on the National Board of Directors of the American Diabetes Association, Ed Hawthorne was the chair of the board. And I have consistently and constantly been impressed with not only his dedication and commitment, but his willing to roll up his sleeves and do whatever needed to be done. I have recruited Ed to the board of directors of both of the Diabetes Leadership Council and the Children with Diabetes. And Ed's retired. He loves going to Italy. He loves playing golf. He's got a whole lot of things that he could do. But Ed said, what can I do and how can I help? That's what we've got to have from everybody. We've got to have Ed's kind of commitment to jump into the fight, throw a bucket of water, because we don't have a fire hose on diabetes, do we, Ed?
No, we sure don't.
We throw a bucket of water and a bucket of sand on a burning fire and try to make a difference. How do you stand it? People ask me that all the time because I've been doing this for 35 years. As you know, I lost a son who had type 1 diabetes actually 1 year ago today. And so how do you do it? You realize that the system is slow, but you do it the same way you get gold. You take that they did back in the 1800s. You take a pick and an axe and you chip away at it until you get what you need. There is no easy solution to making policy correct for people with diabetes. There are little wins. Ed and I remember before the Americans with Disabilities Act covered people with diabetes. Mm-hmm. And Ed and I both worked tirelessly to try to make that happen. And now it's happened twice. It's been signed by two presidents, both of them named Bush, who signed the American with Disability Act update and the original one that gave people with diabetes rights that they didn't have before. So success can happen if enough people are like Ed and are willing to stand up and be counted. I got to tell you, I said it before, as long as there's breath in my body, I will be continuing this fight. In Deepak, we're building an army. What we're doing is building an army to be able to respond, the National Guard, as your daddy called it, Julie, the National Guard, to build an army to be able to respond when necessary. And these things are like a whack-a-mole. You remember in the old arcades, Ed, where they had that big thing that you're whacking that mole? And that's what we do. We play whack-a-mole all the time. Just when we think a state has got it going the right direction, somebody thinks they're doing the right thing. Legislators don't do things wrong because they want to. They do it because they don't know any better. They support something the wrong way because they don't get told what they need to do for diabetes. That's what people like us have to do, Ed. Yep. People like us have to tell them. Ed's been fighting in California for a number of things. And if it weren't for Ed, we wouldn't have some of the success we've had in California. And that's the Republic of California is a huge state. It's a place that you have to have somebody playing whack-a-mole constantly. Yeah. Julie and I play in Kentucky. It's a much smaller state. It's still, the moles seem to get under our feet before we realize it, but it's a much smaller state. Yeah. So I guess the answer to your question, I know you asked me what time it was and I told you how to build the watch because that's what I do. I guess the answer to your question, Julie, is you got to have faith, hope, and persistence.
Most definitely. I think I appreciate you walking us through all of that because it's all important. The last question I had for you was just specific areas of passion. Stuart, I know one of yours is rationing. Ed, I know one of yours is health equity. If Ed, if you want to just touch on briefly some of the other areas of interest or that one specifically, we've got just about 30 seconds.
Oh, we have 30 seconds because I wanted to talk about this push and what it's meant for
Okay,
us.
we've got a minute. We got a minute.
So I think Stuart is really spot on. It is, if you're an advocate, you got to fight, you got to push, you got to use your power because collectively it is more powerful than you think. And if we're ever going to make progress in care and prevention and eventually find a cure, that's what we have to do. So over the last 20 years, real quickly, these things would not have happened without the army of advocates that Stuart spoke about. We've had major reductions in diabetes-related complications. We've had heart attacks and death from cardiovascular disease decreased by 60%. We've had strokes and lower extremity amputations decreased by 50%. We've had end-stage kidney failure decreased by 30%. Since 1995, the availability of oral medications to treat type 2 diabetes has extended from a single class to 8 classes. Recent decades have seen the development of new injectable medications, including fast-acting and long-acting and combination of insulin therapies. And then the translation of clinical advances in diabetes care communities to education and advocacy, including addressing specific needs of disparately impacted populations. These things would not have happened without the advocacy and the impact of the work that all the advocates are doing each and every day.
Yeah, I think that's
What he said.
Yeah, I was going to say that pretty much sums it up. Thank you guys so much. Thank you for the work that you continue to do every day. Thank you for the work that you've done over the years, for being really pillars in the advocacy community. We're grateful to hear from you and hear what advocacy looks like firsthand and how to do it successfully over the years. So thank you. I just want to wrap up by saying we're going to send out a follow-up email with our social media, with Hill Day registration information, with a video from one of your own state representatives, but don't forget, or state senators rather, the way to be involved again is to register for events, to sign up to be an advocate, to recruit friends and family, to follow us on social media, to stay in the know, and we're going to help you do that. So thank you guys so much for joining us today, and we really look forward to being active in Florida, especially as the session starts to gear up for 2022. Thank you.